So in this segment, we're going to be talking about NHS waits force patients to pay for private operations, and this is it now. This is what I think what the Tories always wanted. They've always hated the NHS, and this is it. I remember Starmer brought up in PMQs there were two people. One person, I think he needed knee surgery on an ACL tear, who had to crowdfund and go private, and there was another person he mentioned. Their story, I think, it was a wait for an ambulance where the person's mother sadly passed away because the ambulance took over an hour to get there. I can't remember the stories quite clearly, but it was very scary stuff. But in this segment, we're going to be talking about the kind of rise in more and more people getting private treatment because they can't afford to wait. And some of the stories here are pretty grim, let's be honest now. Long NHS waiting times appear to be pushing people into paying thousands of pounds for private treatment. And let's not forget, a lot of these people will be on the PAYE system. So effectively, their national insurance and their taxes will be taken straight out before they even receive their wages, effectively, or salary. There were 69,000 self-funded treatments in the UK in the final 3 months of last year, a 39% rise on the same period before the pandemic. So what you can see is a massive increase in the amount of people getting private treatment. Experts say it was a sign of how desperate people had become. And these are only people who could afford to get the surgery, whether they had to take out a loan, had the money at hand, or crowdfunded it. I mean, this is grim. This is stuff you hear about. This is stuff you hear about in America, not in the UK. At least that's what you'd hope. The BBC has seen evidence of people taking out loans, resorting to crowdfunding to pay for private treatment. The number paying for care topped 250,000 last year. For common operations like hip and knee replacements, that can cost up to about £15,000. That's a lot of money. And these are routine operations generally that the longer you leave it, the worse it can become. Even me, I've got some pain in my Achilles, but I don't want to have to wait months upon months to try and get treatment for it. Patient groups have warned there was a risk of a two-tier system being created because effectively you have people who can, in some capacity, afford to pay for private treatment and those who can't, and there are a lot of people who can't, with the poorest losing out because they were the least likely to be able to afford to pay for treatment. She says, this is someone's story, I couldn't work, so I took out a loan for an operation. I mean, this is pretty grim. Katie Hopper, 19, had been struggling with a knee operation or knee problems for a number of years, but it got so bad this year, and you would think that under a proper functional system she would be able to go to the doctors and get a referral early on rather than it becoming so bad. I'm not blaming her for it, it's the system that's the problem. The NHS should pride itself on preventative care, but the simple fact is it doesn't work anymore. The GP system's broken, the hospital system's broken, everything's just gone wrong. She ended up effectively stuck in her bed, unable to work, and one of the reasons why healthcare was created for workers was because they didn't want people who were just sick off work, because it impacts the country's economy, impacts productivity. So one of the reasons why I think it was Lloyd George who created certain provisions so people can get healthcare if you're a working person, he did that not because of the goodness of his own heart, but he did it so it wouldn't affect productivity. She was suffering dislocations, nerve pain and muscle spasms. I can't imagine how painful that stuff is. These were preventing her from working as an apprentice engineer, and that, an engineer is a great job. She was training up to do something that is very helpful to the country on multiple different levels. Or playing basketball. Now, basketball, you need a lot of agility. I'm rubbish at basketball, but I do play on very rare occasions, at which she competed at a high level. So again, I don't know if she was paid for it semi-professional level, or played at a high regional level for free. I don't know, but you can see how much this hampered her life here, her working life, and potentially her social life. She says, I was pretty much bedbound. I was feeling very isolated, very lonely. My mental health was definitely struggling, she said. And, that creates a further problem when it comes to mental health as well. Even more costs, even more problems for the NHS and the person who is suffering because of the Tories. Katie was told it would take up to 2 years before she could get the treatment she needed on the NHS. 2 years is a long time. She says, I couldn't wait that long. I would have lost my job. It's a very active job, and I couldn't do it. And again, she would have been stuck on the DWP system. That's ultimately what would have happened, but she had to pay, to get treatment. She said in the end she took out a loan to pay for the treatment to be done privately. In April, it cost her more than £7,000 with the follow-up physiotherapy she needed, but also was operated on within 2 weeks. You can see how tempting it is if you can get the money together just to go private, to borrow the money. It's wild. She says, it put me under financial pressure, but it was worth it 100%. You can earn money, but you can't earn back time, which is true. But, the simple fact is she's in £7,000 debt she should never be in. That's Tory Britain. There are now more than 6.6 million people waiting for hospital treatment in England. That's just England. 1 in 9 of the population. And ministers have warned it could be 2024 before the numbers start coming down. It's wild, the rise in the number of people paying for private treatments here. You've got the most recent figures. It's madness to me, honestly. And if we have a look at this graph here, right, this will show you, so up to 18 weeks, so you can see a large rise under the Tories, right? We can't see it under Labour purely because Public Health England was only created under David Cameron. But if you look at it, you can see a very steady rise of more and more people waiting longer for routine operations. You can argue, as the population ages, they need more help, but you're talking millions of people here waiting longer for treatment. And here you've got 18 weeks to 1 year. 18 weeks is a long time. There are 4 weeks in a month. 18 weeks is a long time to wait for treatment, right? There are more people waiting 18 weeks to a year. That's all in yellow. You can see a very steady increase. And you've even got some in red here at the start, more than a year for routine operation. You can see some red there. It fades out. You've got more and more people in yellow. It could be more people paying for private treatment. We don't know why that red kind of dies down very quickly. We see in yellow, lots of yellow just growing. I think about 1 million people waiting between 18 weeks to a year even. And then you've got a massive dip because obviously the pandemic happens, less people going to hospitals and stuff. And then you've got a massive increase and more in the red. It's madness. This is a system breaking here. There's a couple more things I want to talk about, which is Brenda Pugh developed severe osteoarthritis in late 2019 and was told she needed a double hip replacement. She got one on the NHS but had to go private for the other. I don't know why they couldn't do both on the NHS. Very, very weird. She was only able to do this after a person heard about her case and they saw her interviewed on the BBC. Someone paid £11,000, and she's very lucky in a sense that someone paid it, and I think she admits that, she accepts that. But what about all the other people who couldn't go on the BBC, couldn't get interviews, and weren't lucky enough to have someone pay out for the treatment? Miss Pugh, who's in her early 60s, said there were thousands of people in her position who were still suffering because they were unable to get treatment. She said, "It's not right. We've all paid our national insurance contributions, we've paid our taxes, we've all paid our dues, and to not be able to get treatment is just immoral." And that's what the social contract is meant to be in this country. You pay your taxes, you pay your national insurance, right? And you should be able to get access to police, to healthcare, to fire services. And even for the people who don't pay in, if they don't earn enough, or if they're unemployed, or if they're a stay-at-home parent, or if they're in university or wherever in school, the social contract is that the state is meant to look after you. Whether it be, if it's a crime has happened to you, if your house is on fire, or your car's on fire, or if you need healthcare. And the simple fact is, the Tories have broken the system. They've broken everything. Society is crumbling around us. Let's be honest now. And then we're going to see more and more health inequality. We're seeing it already with dentistry. Dentistry is an absolute horror show. And now you've got people saying they should charge people for hospital stays. Patients would be charged £8 a day when in hospital under proposals from a former health service boss to raise money for the NHS. Now we're going to a system where it's not free at the point of delivery or free at the point of service. You've got to pay £8. £8 a day this guy's proposing. You already have to pay exorbitant fees for parking. So do healthcare workers. It's just beggars belief. Genuinely, it's just at a point where they've broken it, and people still don't see the damage that's been caused because they might not have to use the hospital. Over 4-hour waits in A&E for certain people. I mean, that's crazy, absolutely crazy. But this is what they wanted, and this is what they got. They've broken the system. But anyways, I'm going to leave it there. Let me know what you think in the comments below. Like, comment, share, subscribe, support the channel on Patreon if you can, and hopefully I'll see you in the next one.